All right, so thank you very much. I'm Jefrey Shumba with the Childhood Development Initiative. I'm going to do a presentation on the impact of COVID on families living in Tallaght. So just a bit of a background about the study that we conducted. So we conducted this study as part of a larger study, which was exploring the experiences of child poverty and its impact on families and children in Tallaght. So what we planned to do was to do this larger study before COVID, but because we were delayed and we had to do the study after COVID, we then adapted our study to capture the impact of COVID, how the families were coping in COVID, so families and young people in Tallaght. And more about the background, just to give a background about Tallaght. So this is how Tallaght looked like in 2016. The population for Tallaght between 2011 and 2016 increased by 6.4%. And you will notice that in 2016, although the population of Tallaght was more than 75,000, children between 0 to 18 years made up almost 30% of the population. And you also notice that in terms of different socioeconomic indicators, Tallaght had more pronounced unemployment rate for both males and females compared to the national unemployment rates for Ireland. And you also notice that in terms of education, there were there was a larger proportion of the population in Tallaght that only had attained primary education. And there was a very lower proportion of the population that had attained third level education in Tallaght compared to the proportions in Ireland. So how we did our study, which was a qualitative study, we did focus group discussions with children between 8 to 17 years, and we consulted with 50 children. 23 were boys and 27 were girls, just a bit more demographics about the children that we consulted on. And 35 of the children, they lived with both parents, and 15 were living with one parent. And 25 children had all parents employed, while 21 just had one parent employed, and 4 of the children had none of the parents employed. But we did also consult with the service providers, which are the various organizations that were working with children and families in Tallaght. So we did 2 focus group discussions with 20 service providers, and this covered a range of sectors with service providers in family support, speech and language therapy, migrant and refugee services, social work, primary care psychology, drug and substance abuse. There were so many, they were like from varied sectors. And we did also conduct 2 focus group discussions with parents, and we had 17 parents in the 2 focus group discussions. So what we did is, in the focus group discussions, we were prompting the participants to discuss how broadly the pandemic affected their lives. But we also noticed that because this was part of a larger study, as we were discussing the other parts of the study, participants would frequently reference to how COVID had impacted their lives and their everyday lives. So in terms of the findings that we had, we found out that education was one of the most affected areas for children. Most of the parents, they were mentioning that they could not afford to access the devices that children needed to use to access online education, because because of school closures, many schools are offering online education, and many parents found it very difficult to access laptops and even to have internet connection. So we had parents who were saying they had to spend an extra almost 200 euro to ensure that their children can get the devices to access online education. So of course, some of the service providers, they did respond to the plight of the children who had no devices for online education, and they did lend laptops to parents, but that's far that they could do. They could not provide internet access to parents and for children to access online education. So some of the remarks that we're getting from parents, they showed us that parents themselves, they had to hotspot using their own mobile phones so that children can access the different online platforms for education, which was really difficult for children. But besides children's access to online education being affected, we also had some parents who were pursuing the different courses and different vocational courses and training programs for their own benefit and for boosting their socioeconomic status. But because colleges were closed and institutions were closed, their training had to move online, and they also found it difficult to access even the training for themselves. So we had service providers who were really implementing programs that were aimed at boosting the socioeconomic status for young women, and they found it very difficult to continue with their interventions and programs because all of the trainings that they were conducting, they were now online, and Wi-Fi again and internet connectivity was very difficult for many families. And generally, we also had some parents who were attending college, and they found it very difficult to access online education. So this education was really affected for the families, not only for children, but also for parents who really needed to access online education. But besides the access to internet connectivity and devices, we also found out that children generally, they were really worried with how they were going to progress with their education, because when we conducted our study, schools had just reopened, but there was a feeling that this was not going to be very long-lived. There were some feelings that schools, again, they were going to be closed. So children were really worried about how exactly are they going to continue with their education. So we found that children, and even service providers, they were reporting that children were really fearful. They had sort of some general stress and worry about how they are going to progress with their education. So moving on to the other part of the impact of COVID, we also found out that COVID unmasked the depth of poverty in Tallaght. So we generally, although Tallaght is relatively a disadvantaged area, the depth and extent of deprivation and poverty was kind of masked prior to COVID. This is because there are a lot of support systems that are available in Tallaght for children and families, but with COVID coming in now, those support systems, they were taken away, and it is only through the response that the service providers were offering during the pandemic that they realized that there are a lot of families that were struggling to access food, for example, and that really showed how food poverty was affecting children and families in Tallaght. And of course, there were many service providers that really responded to the plight of families and provided food deliveries and all and all other necessities that families needed, but it was not really enough to reach out to all of the families. And also we noted that schools before COVID, they were offering like school meal programs. So before COVID, children were guaranteed to access one nutritious meal from the schools. But with COVID, that support was again taken away. This was also compounded with job losses, income challenges. So really, families found it difficult to access food. And this was really also made worse by children staying a lot of time at home, which means they had to eat a lot. And this really affected the access to food for most of the families. Of course, we also did notice that children were affected in terms of socio-emotional health. I'm not going to dwell much on the socio-emotional health impact of COVID. But we did notice that children's playtime outdoors was really affected. They had really little time to play outdoors. And even though schools were reopened, they had restrictions in terms of how they were going to play, like classes were limited so that they could not mix between classes. So it was really difficult for children. They found it very worrying, depressing, that they couldn't do anything with their friends. And they were really worried for children, especially when schools opened. We realized that there were some children who were living with older generations, and they were really worried about passing COVID to them. But we also noted that children began to experience some behavioral difficulties. So we had service providers who were even telling us that there are some children who are now developing stammer. They are now stammering, and these were really pandemic related, and especially on return to school. So we generally found that children, they were really distressed, they were worried, and they were fearful in terms of passing COVID to the older generations in the household. And we also noted that because many families had moved back to live with their grandparents, there was intergenerational living, which had its own difficulties and challenges for children. And also some parents, they were reporting incidences of domestic violence during the COVID pandemic. But I'm not going to go into detail on this one. And so what were the key issues from our study? We found out that education was really affected, but we know that education is very important as a pathway out of poverty and breaking the cycle of poverty. But we really found out that children were really not guaranteed access to education during the pandemic. So what we recommended in our study is a COVID recovery plan, which guarantees access to education for all children. And schools, they should have measures that ensure that children have their right to education guaranteed. And because the pandemic, although there are hopes that the pandemic is almost going now, it's not really certain. So measures should be implemented to ensure that children will not miss again on education, whether this is going to be online education or face-to-face education. And also we realized that access to adequate and nutritious food is very vital for health child development. And we have, in Ireland, we have different strategies that aim at ensuring that children are guaranteed to access to nutritious meals. For instance, the Phase 5 strategy, and then the roadmap for social inclusion. But from the findings of our study, we realized that not all of the families and not all of the children had access to a nutritious meal during the pandemic. So there's need for safety nets for children so that they are guaranteed a nutritious meal, whether they are on school or they are off school, and safety nets should reach children even when they are at home. And lastly, children's socio-emotional health was affected during the pandemic. And as I have presented on children's time of play outdoors, which was really affected, and children showed signs of anxiety, worry, and behavioral difficulties. So our recommendation is socio-emotional supports for children should be provided in schools to ensure that children can recover from the impact that the pandemic had on them. And lastly, the National Children's Strategy for Ireland, which is the Better Outcomes and Brighter Futures, was expired, I would say, last year, because it was supposed to be implemented between 2014 and 2020. And currently there hasn't been a new strategy. So one of our recommendations was that that National Children's Strategy should be implemented as a matter of urgency, and consultations should be made with children and families. And basically that's the start that we did, and would like to thank all the children, the service providers, and the parents who participated in our study, and also to thank TUSLA who financed our study. Thank you.